Good evening, one and all. We welcome. Good evening, one and all. We welcome you all to the international webinar series on holistic health, well-being, and sustainable development 2025. As part of the series, we are organizing various programs like conferences, seminars, webinars, workshops, symposiums, and also commemorating, celebrating various events every day. So, yesterday and today, on occasion of World Suicide Prevention Day, we are organizing international seminar on suicide prevention, health, well-being, and sustainable development 2025. So we welcome you all to the second day of international seminar on suicide prevention in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Art, Sciences and Well-being and IASP. We welcome you all once again. Before we start our sessions, let's take the blessings of Almighty. We request the presenters to share your details in chat box so that we can invite you for your presentation. And we also request all the participants and presenters to register yourself and mark your attendance in Zoom registration form in the form of polls. No need to, those who have already filled the Google registration form need not fill it again, but mark your attendance by filling up the registration form in Zoom platform.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
So with the blessings of Almighty, we shall continue with today's sessions. Today, we will look at various aspects of suicide prevention on occasion of World Suicide Prevention Day. Yesterday, we have seen how the self-identity or the identity of self and different selves, how self establishes identities and how they are impacting various aspects of health. And we also have seen various theories of suicide and how to prevent that, what are the root causes and what kind of interventions can be provided, taken up to prevent suicidal thoughts and to prevent suicides. As we all know by the statistics, every 20 seconds, one person is committing suicide at any point of the world. And every 40 seconds, one person dies committing suicide. So this is the magnitude today we are talking about and organizing this international seminar. Every 20 seconds, you can imagine, if you take the world population, every 20 seconds, that means when we are addressing, when we are having session here, someone else in the world is committing suicide. And imagine in 1 minute, 3 people are committing suicide and 2 to 3 people are dying with suicide. Now, this is the magnitude of people committing suicides. Now, we all need to think, ponder upon how to prevent suicides, because this is preventable. This is 100% preventable. Other disease might not have treatment, might not have medicine, but this one is 100% preventable. By making ourselves available to those who are planning to commit suicide or those who have suicidal thoughts, by reaching to them, they may be in our own families, our own communities, our own localities, or even online. As now, the world has become a global village and we are connected through various platforms. So online or offline, in person or virtually, we have a lot of opportunities to reach out to people. At the same time, we have challenges because of this online connections. People are also committing suicide. See, for everything, there is 2 sides of the coin. One is the positive side and other is the negative side. So what way we are leveraging or what way we are utilizing our technology or ourselves and the outcomes from such activities depends on the thought process, and based on such activities, your productivity also may increase or decline. See, nowadays, with the advent of technologies, mobile networks and free data available or a cheaper data available, data may be cheap. You might be getting unlimited data on your mobiles, but time is not very limited. Time has never increased beyond 24 hours. Every day, we all have 24 hours only. We need to manage time. Time management is very important. After time management, prioritizing is very important. How people are able to do so many things within that 24 hours and how people are struggling to complete their work within 24 hours. It all depends on setting the priorities and also deliberating the work and also saying no. We often have difficulty in saying no. No to work, no to persons, no to tasks, no to events, no to programs. That is also very much necessary because we cannot overburden ourselves beyond our capacities and limits because we all have limited resources. So we should do SWOT analysis of ourselves and we should be able to say no if we can't take it up. So a clear no saves us and also saves others. Because when it is not possible or when it is beyond our capacities, then we are under stress. Because of stress, anxiety builds up. And because of anxiety, stress and anxiety are not manageable, then you can get into depression, the cycles of depression, and finally that can lead to suicidal tendencies or self-harm or harming others. So all these aspects, all these factors can be contributing to prevention. So that's why first identifying our resources and managing time and deliberating, prioritizing and deliberating tasks is very much important. If we are not able to manage these things appropriately, then we'll be losing out on time, losing out on schedules, and losing out on various aspects which over time creates issues at both physical end and also at the psychological, emotional, social, economical, and all other domains of health. So it is very much essential for all of us to be aware of these factors which are contributing to such situations and to easily get through the situations. So always try to say, no, do not take the burden if you are not able to do it. So that reduces stress and anxiety. Be realistic of what you can do or what you can't do at that moment. Maybe after some training, after some motivation, or after some time, you may be able to perform it. But always go with your gut feeling. At the same time, leverage the benefits. Not every time we get the opportunity. So whenever there is an opportunity, we need to balance our time, resources, and also the opportunity so that we utilize the potential of the opportunity and gain from it. So today, as we have dealt with theoretical part, let's move on to practical aspects as on this International or World Suicide Prevention Day. Changing the narrative on suicide. There is a lot of stigma, taboo that is associated with suicide. But we need to have different narratives, perspectives on suicide, understanding the suicide, approaching the suicide, talking about suicide, invites communities, governments, health professionals, media, civil society, because we need different narratives. We need different perspectives. We need to understand in a legal point, we need to understand in a psychological point, we need to understand in a social point, we need to understand in a cultural context, we need to understand in a religious concept. So all these different contexts or perspectives or narratives will help us to understand and adapting to the local cultures and traditions, local context, so that people can seek help in ways that respect our culture and identity. So first of all, we need to reach out to people so that they can reach out for help when there is a need. So this reaching out is essential to address, to prevent suicides. This has become a public health problem, the result of interactions among biological, physiological, psychological, social, cultural, economic, and structural factors. Especially, country like us has complex social determinants like gender roles, gendered expectations, peer pressure, family pressure, student pressure, and student stress, employment precarity, agrarian distress in some regions where we see farmers or agriculture and allied industry. We see farmers and laborers, agricultural laborers are facing issues and limited availability of trained mental health professionals. So this is also an important aspect. We have counselors, we have psychologists, but how many are certified? How many are trained? First of all, having a resource persons who are trained, who are qualified, who are certified. There is dearth of these professionals. And second thing, among these, how many are certified and trained or qualified? That is another issue within the human resources. Especially, there is a huge divide between urban and rural areas. Urban areas, to some extent, it's better compared to rural areas where we hardly find such a source. So there is a great potential to reach out to rural areas. So how do we address this huge gap in human resources or human capital? These create a pressing need for strategies tailored to Indian socio-linguistic realities, socio-economic realities, socio-cultural realities. So we need to have campaigns, public campaigns, mass campaigns. At the same time, we should not ignore local languages, metaphors, idioms, similes, and communicative norms, because we'll be missing people who need the most. Conversely, linguistically and culturally sensitive strategies can improve reach, reduce stigma, and strengthen early help seeking. Why this is required? But when a communication is culturally appropriate, when a communication is in the local language, it's easy to communicate and people also feel connected and respond back for seeking help or support. So there are various initiatives like Telemanas and Kiran helplines are there, which offers evidence-based recommendations in prevention and addressing of health issues, including physical, psychological, social, emotional. And India's helpline, basically telemental health efforts are expanding, and inclusion of languages and discourse strategies in the service will crucially influence whether vulnerable people connect with care. So it is very important the way we communicate, the language we use, the modes of communication we use, how appropriate, how culturally appropriate, how, what kind of language we are using, what dialect we are using, all have a significant influence on the effectiveness of the communication. As we know, this tri-annual theme for the World Suicide Prevention Day, changing the narrative on suicide, emphasis that calls for reframing public conversation, challenging harmful myths, and expanding accessibility through language and also translation of existing resources. IASP, which is a global NGO, global association that encourages translation and local adaptation of messages to reach communities in their own words. So that is very much essential. Even the new education policy 2000 also focuses on building up multilingual education and also communication. So this global orientation aligns with evidence showing stigma reduction and helps seeking increases when messages are culturally appropriate. So here, when we are saying changing the narrative on suicide, the term narrative here refers to the collective stories, metaphors, and discursive frames used by individuals, families, communities, media, and institutions to understand suicide. So, dominant narratives that portray suicide as a stigma, laden moral failing on the irrevocable, and act that obstruct help seeking and can lead to social exclusion. So, by contrasting such narratives that emphasize crisis, reversible suffering, and support options, promote intervention and recovery. So, World Health Organization and IASP recommend multi-sectorial approaches, gatekeeper training, safe media reporting, accessible helplines, integration into primary health care, school-based mental health literacy, and culturally adapted interventions. This should start with the family itself, at the home, and in school, colleges, universities, higher educational institutions. For low and middle income settings, such as in India, low cost, language appropriate strategies like telephone counseling, online counseling, community volunteers, training of professionals and paraprofessionals will have a huge impact. When we look at the trends by NCRB, there are various challenges because Indian suicide epidemiology varies by age, gender, and region. Young adults and students are at high risk group. Economic stress and interpersonal factors contribute markedly. Media reports and scholarly reviews document repeated calls to helplines and rising mental health service demand. Early intervention can reduce suicidal risk. So early intervention and prevention is better than cure. So what would be the challenges? Think over it. There is large gender gap. Now why? This is one of the major problems. Male to female ratio gender gap. The ratio of male to female or female to male also impacts the gender inequality or gender proportions. So that is why that also impacts social order and also sometimes brings out law and order over a period of time issues. How? See, just taking one example, if every one man as a woman, when the ratio is 50:50, or say 1:1, so there is adequate gender equality. So everyone gets, because it's quite natural, to pair together. So there is an equal opportunity in the family institution. What if for two men there is only one woman? Now imagine the crisis. Or say for 5 men, there are only 3 women. Or imagine for 10 men, there are only 3 or 5 women. Imagine what kind of stress or what kind of challenges it can bring. This is one perspective, one narrative I am giving you. How gender also impacts. Gender ratio especially. Both are equally important. Male and female. Both are equally important. Both have to be in the same ratio. Both have to be equally educated, empowered, employed, so that that ratio is maintained. But what is happening? In reality, the female population is coming down because of various reasons. Due to this, there is an imbalance in gender ratio that is causing a different kind of problems. So that is one aspect coming to population. So there might be several factors like this. So you can also suggest some in the chat box. So we can also discuss. Let's make it more interactive through chat. So you can keep responding. You can select the host and or co-host. You can keep sharing the messages as and when ideas ponder you or questions ponder you. And stigma and legal legacy. Until recently, in India also committing suicide is illegal, right? That means if you are committing suicide, you will be put behind the bars. You will be taken for a trial and you will be sent to jail. Now, with this situation, how many of them who are planning to commit suicide, or how many those who have attempted suicide will come forward and seek for help? Because it's illegal. You cannot commit suicide, right? If you say, I'm planning to commit suicide, or I have committed suicide, then you have committed a crime. Then you are punishable. It's a punishable offense, right? So this was also a barrier for the people who have suicidal tendencies or who have committed suicides, or at least those who have witnessed these events were not able to reach out to protect their family members, friends, or community members. So until recently that has been removed, and instead of punishing them, they are provided with support, psychosocial support now. So still we can see in more than 23 countries, suicide still remains illegal. So these are various gaps. We are addressing legal barriers, but still stigma persists. And moreover, the distribution of mental health professionals are more concentrated in urban areas. As we already have spoken, we discussed, rural areas compared to rural areas, urban areas are better with facilities, including infrastructure and human resources. So let's talk about language. So framing words matter. So research in health communication shows that terms such as committed suicide versus died by suicide. Is there any difference or not between the words committed suicide and died by suicide? Can be proactive in chat. These two words, pair of words, affect stigma and perceived culpability. Right? Person-centered, non-stigmatizing language like attempted suicide or survived an attempt or died by suicide reduces moralizing narratives and supports help seeking. So that's why the words we use, the framing labels, based on the framings are the labels, because people will be labeled that he or she has attempted suicide. He or she has survived an attempt, or he or she died by suicide. So this labeling also happens by how we use the words, and based on that, the consequences also. It can be positive, it can be negative, or it can be both at times. So often there is also cognitive framing that happens, use of metaphors. People use metaphors like dark tunnel, weight, droning to express suicidal distress. So understanding common metaphors in a community helps adapt interventions, because people may not come directly say, I want to commit suicide or I'm thinking of suicide. They might use some words or they might indirectly communicate using metaphors. So like already mentioned, dark tunnel, weight, droning, want to be alone, isolated, withdraw from wherever they are, from work, for family, or from community, not interested in anything. All these convey that they are withdrawing themselves. And understanding such language, their literal meaning is different, but metaphorical meaning, it varies in cultural context. So understanding the meaning is very important, and practitioners especially should attend to the metaphors as cues to emotional state and cultural worldviews. And also, translation is also very important. Translation, transliteration, localization, multilingualism are very important aspects, especially when coming to narratives. As World Suicide Prevention Day 2025 emphasizes translating resources into many languages, and India is a linguistically diverse country with more than 1,600 languages spoken in India, and with 22 constitutionally recognized languages. And within that, we have different dialects. If we, for example, take Telugu states, we have Telangana dialect, we have Andhra dialect, we have Rayalaseema dialect, we have Kostandhra dialect. And when there is a convergence of these two dialects, we have again a different dialect. Like there is a formation of Pidgins or Creoles, that is a dialect in process, a language in process. So these aspects, especially, can also impact the communication. And sometimes there are different ways of translation which can altogether communicate a different meaning or may not appropriately translated. So there are some translation challenges like word-to-word translation, phrase-to-phrase, sentence-to-sentence, or clause-to-clause, or total para-to-para. So there are certain challenges when coming to translation. So it should not be merely translated, but it should be socio-linguistically adapted. So we need to be conscious about register, idioms, faith-based sensitivities, culturally appropriate. So helpline scripts or communication, child prevention communication or support should be available in major languages, especially major regional languages, local languages, and dialects, where they feel it's their own language and can connect it. And we need to understand how this communication is offered and accepted. When you are addressing them in their local dialect, local language, that is very well accepted. And they can relate themselves, correlate easily. And they are more likely to open up. So the interactional pragmatics at the micro level of how the conversations, how talks unfolds in crisis calls matters, because that prevents the acts. Effective crisis communication often uses open questions, reflective listening, and safety-focused language. Curt, directive language can shut down callers. Empathetic minimal encourages, invite disclosure. So training must include real-time call transcripts in local languages to model culturally appropriate pragmatic moves. So coming to media, how print media, electronic media, digital media, online media, social media reports the events related to suicides or aftermath of the event. Media reporting conventions influence contagion risk. So sensationalist or detailed descriptions can increase suicide contagion, which is also known as Werther effect. So discursive guidelines, that is safe reporting, even UNESCO World Health Organization has also suggested some guidelines for media for reporting, safe reporting against such crisis situations that include language choices, avoiding detailed methods, and providing helpline information are essential. We can see some media, how they are promoting. Instead of providing information, they provide different methods and they explain in detail, which is unnecessary. People, take it in a different way. And people are nowadays using them in their real life, especially these daily soaps, serials we see, there is a huge impact on these family relationships are getting affected. There are even a research study recently, there are many studies coming up interestingly, and especially those who are in behavioral sciences, psychology, counseling, or you can also take up wonderful, studies. Even we also conducted few such studies on cartoons and daily serials, and we have seen interesting outcomes. And even many more researchers are coming out. It's a positive thing that how these are affecting our day-to-day conversations, day-to-day relationships with our family members, neighbors, community, relatives, and what kind of content we are exposed to that also impacts our health and well-being. Information is bombarded everywhere. What kind of information you are allowing, what kind of information you are exposed to also impacts your physical and mental health. That's how the media is also playing a dual role. One side, it is struggling for its survival identity crisis. Other side, it is not able to maintain its morals, ethics, and values. So in between, sometimes they are compromising and giving more priority for their survival or their popularity for TRPs. So in this process, communities are misinformed, disinformed, or ill-informed so that they take wrong choices or make wrong decisions that impacts their lives. As they follow or they create propaganda and people follow them and they are the victims of such propaganda. So yesterday, one of the resource person was talking about social work practice and community interventions. Like community-based prevention models where community workers, social workers are a key in community mobilization, identifying at-risk individuals, coordinating referral pathways, advocating for structural supports like financial counseling or financial support, family support, social support, if required, mediation, arbitration, and so on, so forth. So community mental health services or teams or groups can train local cadres like ASHA workers, Anganwadi workers, NGOs at grassroots level in basic psychological first aid. Anyone can learn, for that matter, psychological first aid. So social work interventions address unemployment, debt counseling, gender-based violence, and family conflict, and so on. These are all the determinants or the factors that contribute to suicide. So if these are integrated into the suicide prevention and considered into existing social welfare schemes and livelihood programs, so it strengthens prevention, because once we are able to show a solution among the available options. So definitely it can be prevented. So school counselors, especially placement officers at schools, colleges, universities can run mental health literacy workshops and gatekeeper training. Social workers, counselors, psychologists can partner with student unions and HRs to create a crisis protocols. By using local community languages, by reaching out to faith leaders and culturally respected narratives, perspectives to destigmatize help seeking, people outreach, village level listening circles moderated by training through trained social workers, psychologists, counselors in local dialects, making it more culturally sensitive, appropriate outreach and awareness programs. And yesterday, our resource person, Dr. Sri Krishna, was also talking about role of clinical psychologists, rehabilitation psychologists, psychiatrists, counselors, and clinical assessment and clinical management and risk assessment and management. And he was also mentioning about various evidence-based interventions like cognitive behavioral therapy, dialectical behavior therapy, DBT, REBT. These elements reduce suicidal behaviors. And even crisis intervention method, immediate safety planning, removal of means and ways where possible, and scheduling frequent contact to postpone and to prevent is very much essential. Training layman and budding counselors or paraprofessionals in brief evidence-based techniques increases the outreach scope because we have limited resources, human resources. So it is very much essential to leverage the human resources available and train doctors, allied health professionals, paramedical professionals like nurses, and other staff for psychological first aid and in suicide prevention programs. So we need to have universal as well as selective prevention strategies like media guidelines, which are universal strategies across the world, which are culturally appropriate, using non-stigmatizing language, and school-based mental health literacy in regional languages, which are appropriate to age and class. And events like this, online public events, offline, that can represent local examples and helpline info. Yesterday, Madam was mentioning about various local helplines like Telemanas and so on, and reach out to various organizations across India. Like there is a website, yesterday it was mentioned, Find a Helpline, which connects to helplines across the world. You can search helpline anywhere in the world. Just go to website and search your place. You'll find one nearby, at least in your state or district, depending on the availability. You can find one in your state where you can approach. So similarly, selective strategies should be prepared, adopted based on the target groups like adolescents, children, farmers in agrarian distress regions, LGBTQ youth, and survivors of domestic violence. Based on that, we need to have appropriate strategies. And community outreach programs should also target messaging using narratives that resonate with the group. Like students, we should be having students focused campaigns on campus. For farmers, we need to have similar strategy. Like crisis lines, emergency psychiatric care, follow-up after self-harm, safety planning, and means restriction, like keeping away these pesticides, storing safely in agricultural areas, or withdrawing sharp objects like knives or firearms, withdrawing or safeguarding from firearms and any object that can be used to commit suicide. So regulations on the means for committing suicide, like pesticide availability, safe storage campaigns, and regulations of firearms and other objects, lethal objects, reduces impulsive suicides. So even at homes, ensure that these are not easily accessed. There are barriers in accessing these, so that in an impulsive moment, you don't commit something that you regret later. So gatekeeper training should be designed in such a way with modules or key components for recognizing warning signs and also understanding the metaphors and other elements used locally. Use non-judgmental opening questions. Create immediate safety plans and reference, and avoid stigmatizing phrases and translate phrases into local idioms that encourage help seeking. Provide a sample gatekeeper script in English and national language like Hindi and many more languages, like especially in regional language, local language, at least 2 Indian languages like Telugu and Hindi, or Telugu and Urdu, or Tamil and Hindi, or Kannada and Hindi, or Gujarati and Hindi, anything which is more appropriate to your area, locality. And brief, practical, which can be used for training in gatekeeper training programs. And media should also avoid method descriptions, avoid sensational headlines, include help resources, and avoid glamorization. Provide a checklist for journalists and sample headlines, rewritten into safe forms. You can do a research, collect how media has reported suicide cases and how they have taken trial on media and aftermath. You can collect those and do a case study or do research, and you can also suggest changes, how it can be used or how it can be adapted or modified in such a way that it has more of positive impact than negative impact. Social media platforms need quick response, rapid response moderation policies, and prompt referral to crisis resources. Use help first automated messages in regional languages for flagged content. You can see if you type suicide in Facebook, Instagram, or WhatsApp and search, or in Google, you search, what you will see, it should immediately show you help or support page. Because why? Because you are looking for something and it should help you to prevent that. That is one of the basic strategy here. That's why even the content moderation also, like we were discussing yesterday, we also had one more observation yesterday, like what Nepal, recent Nepal things are happening, the identity crisis or identity formation. We had similar observation here, like few of the participants were more concerned about not able to send messages to everyone or not able to receive messages from anyone. That was not a big issue because, if you want to respond, you need to connect to the speaker, right? Only thing is, if you want to give a feedback, you can directly contact to the speaker or the resource person or the host. That's enough. We need not post everything into common thing and create an inconvenience for everyone. So that was one observation where we are, without our conscious thinking, without our conscious efforts, we are getting into such situations. So we have to be very conscious of what we are doing. And another instance, what happened, I'm giving you how social media is trained, social media platforms are trained. Yesterday after the session, as long as the session went live, the entire recording was on YouTube, live stream. But immediately once the live streaming ended, the social media platforms, they scan the content. So why we are talking here is a responsible moderation of social media. Social media or online media, for that matter, any platform should be responsible. They should have a responsible moderation. Sometimes it can also create a false positives to negatives. That is always possible because of the communication we use, the words we use, because it scans the entire conversation and it is the words like suicide, homicide, or murder, or homicide, like these words, if they are repeating more, or if the content is more of which is making people to think over it, especially content where there is a sensitive content like suicide prevention or talking about suicides. So we have these kind of challenges where content can be moderated or temporarily removed for further moderation. So we need to, again, they might have certain challenges. So we need to again inform them and assure them that this is not promoting any suicide, but it is preventing suicides. So these kind of false positives or false negatives, especially when AI is involved, it can also create some hurdles and challenges in reaching out to people. So these are our challenges where we need to be very careful, especially when reaching out to masses. And there are also various other factors also. Anyway, it is not a context. So I'm not getting into detail, but whenever there is an occasion, if you are fortunate enough to join, we can also have discussion on that. Evaluating the impact of multilingual campaigns on knowledge, attitudes, help seeking, and call volumes. Because this is very much essential, taking feedback. Otherwise, how we will know whether that has created any impact or not? And if it has positive outcome or negative outcome, and appropriate design, whether it can be a qualitative, quantitative, or a both, like pre-post surveys on mental health literacy among target groups like students or scholars or faculty members or even community members. We can say ASHA workers, Anganwadi workers, or sanitation workers, and we can analyze it. Qualitatively, we can have focus groups, discourse analysis, linguistic analysis, stylistic analysis of media coverages, thematic analysis of media as well as helpline call transcripts to assess changes in the metaphor usage and help seeking language. So how people are looking out for help. And also, we need to take care of ethics, ethical considerations, and safety. So obtain institutional ethics approval, ensure immediate referral pathways for participants disclosing suicidal ideation, de-identify data, is remove any personal details, personal identification details, and follow safe transcription protocols if it has to be disclosed. So, as already mentioned, in India we have Telemanas, which has rolled out in a multilingual implementation with steps, training language modules, increased call volume, qualitative improvement in callers' perception, using quotes paraphrase to avoid privacy issues and logistical lessons. And when we look at Kiran helpline and its rehabilitation linkages, which is a national toll-free mental health rehabilitation helpline supporting multilingual access and early screening. So this outlines how social workers coordinate with rehabilitation professionals as assistants. And apart from that, we have many NGO-run helplines, like yesterday our speaker was mentioning about Roshni, Asha, and many other, Sanjeevani, or One Life, and so on, depending on the area, community. We can have NGOs, hotline contributions, because they are local, so they will have rapid response, and they have peer counseling and campus peer support programs also can be increased that will increase help seeking and referrals to the mental health services. So even in campus, we need to have psychosocial support counseling centers like in Osmania University. There is Saham Counseling Center. And in similar other universities also, they have certain counseling centers which are maintained by different managements. So such centers should be available in schools, colleges, and also in campuses. So like helplines which are widely available, Telemanas, which is run by Ministry of Health and Family Welfare, you can call 14416, which is a 24/7 mental health support in 20 plus languages. So you can talk to in 22 languages, whichever language you are more comfortable, and link to local services, which is ideal for immediate counseling and reference. So the Kiran helpline is also a 24/7 toll-free mental health rehabilitation helpline. You can dial 1800-599-0019. This is launched by the Department of Empowerment of Persons with Disabilities for mental health rehabilitation and early screening, available in multiple languages. And we have NIMHANS helpline. You can reach out on 080-4611-007 for clinical advice and counseling, which is Bangalore-based institute, National Institute. And we have other NGOs like One Life, which is Suicide Prevention and Crisis Report. You can reach out on 789-300-78930, which is an NGO-run service with helpline and digital outreach. Apart from that, there are many other like Venerable Foundation for Crisis Intervention, Jeevan Astha Helpline, Suicide Prevention and Mental Health Counseling Support with toll-free number as 1800-233-3330, and so on. So similarly, various helplines are there. You can reach out to findahelpline.com. You can visit this website. You can bookmark it, findahelpline.com, and you can reach out to local organizations that help connect to regional or local resources for the communities. So as we already spoke about ethics, confidentiality, and other legal considerations. So we need to discuss the duty of care, confidentiality limits, duty to warn, mandated reporting if applicable, and culturally sensitive consent. And also we need to be emphasizing of continued need for compassion and not on punitive responses. So now when we are talking about reaching out to masses, we need to prepare materials into regional languages, local languages and dialects, and distribute over online or offline, and also through mass media like local radio or community groups, and so on, including helpline numbers in such material, communications, and mandate inclusion in a media coverage, and also organize and train more gatekeeper training for teachers, for health professionals, para health professionals, allied health professionals, and so on. Integrate suicide prevention modules, language sensitive into university, college, school orientation, and workplace wellness. Strengthen helpline, clinical supervision, and data sharing protocols. And we need to have a policy push for means restriction like pesticide policy, expanded mental health workforce, and incorporation of suicide prevention into primary health care, and language adaptation so that it is locally appropriate. And all these measures can be taken up as the magnitude of suicide, as already mentioned, one of the pressing yet under-discussed public health epidemic challenge of the 21st century. Globally, as more than 7 lakh people die by suicide each year, as per World Health Organization 2023 statistics. That translates to one person every 40 seconds. So beyond these deaths, there are millions of people who attempt suicide, contemplate ending their lives, or are bereaved by the suicide of a loved one. The ripple effect of each suicide extends to families, workplaces, so the ripple effect of each suicide extends not only just to family members, but also workplace, schools, and entire communities. And in India, with its vast population and unique socio-cultural dynamics, suicide represents not only a mental health crisis, but also a crisis of communication, crisis of identity, crisis of societal responsibility. So language is not neutral. It carries cultural meanings, frames, attitudes, and influences behaviors. That's why the terms like committed suicide implicitly criminalize an act that is no longer punishable under Indian law, while alternatives like died by suicide recognize it as a public health concern rather than a crime. Similarly, metaphors used in daily talk, such as life is a burden or no way out, signal distress and can either be dismissed or taken as early warning signs, depending on the listener's linguistic awareness. So, in multilingual contexts in India, like we already discussed, where 22 scheduled languages and hundreds of mother tongues and dialects coexist, the ability to adapt suicide prevention messages into locally meaningful discourse is critical. So a prevention strategy is effective in urban English-speaking contexts may become irrelevant or not appropriate in rural communities where people primarily communicate. So even at international level, IASP provides resources, organizes World Suicide Prevention Day, and promotes best practices. For further information, you can visit website. And World Health Organization issues global action plans like World Health Organization Mental Health Action Plan 2013 to 2030. United Nations integrates suicide prevention into sustainable development goals, especially Goal 3, good health and well-being, which aims to reduce in Western context, suicide is often discussed through medical psychological frames. In Asian context, notion of honor, shame, and collectivism shape narratives. In India, religious perspectives like Hindus, Islamic, Christian, Buddhist may have different views on suicide as sin, karma, or moral failure, reinforcing silence. So the prevention strategies must adopt to the cultural scripts. Good lessons show that narrative of resilience. So with this, we shall take a break and see if there are any queries, observations. Feel free to share. No queries, no suggestions, no observations. Okay, at this point of time. You can use chat box to respond. We'll take a short break for you to respond. Then we'll move on to the prevention strategies, tips. I need some from your side so that I can also contribute from my side. Keep texting in chat box. Okay. Have you come up with some strategies? Prevention strategies, tips, how we can prevent? Okay, let's look at what World Health Organization framework global strategies suggest. World Health Organization recommends restricting access to means like pesticides, firearms, knives, and so on, and responsible media reporting so that it does not promote any such acts or glamorize such acts, early identification, treatment and support, training health workers, and also the common people for psychological first aid and identification of suicidal symptoms so that they can reach out for help, fostering life skills in especially children and youth because they are having the highest rate who are committing these acts. So at a policy level, Mental Health Care Act 2017 decriminalized attempts focusing on care instead of punishment. So at an educational level, programs like life skills education in schools, colleges, and institutions, organizations can help periodic training and awareness at community level, like farmer support helplines or community awareness programs, community outreach programs will help. At technological level, AI-based suicide detection in social media apps, like whenever you search for suicide, you get a help support. And whenever you have a lot of communication that happens on suicide, it also reports to helplines and government agencies. So this is to as part of prevention strategies because it can save lives. So that's where the ethics, confidentiality, privacy also comes into place. But at the same time, we can save a life. So now at an individual level, we can encourage open conversations, listen without interrupting or judging, reduce access to harmful means at homes, provide emergency contacts, like we have seen Kiran and Telemanas. And apart from that, any local NGOs that are working in your area. So in media, especially, which is a double-edged sword, as I have already mentioned, the responsible reporting can create awareness and reduce stigma. But sensationalized or insensitive coverage may contribute to suicide contagion and it can contribute to more suicides. So language and framing play critical roles in shaping public attitudes. In India, where newspapers and television reach millions daily, media communication is a key component of suicide prevention strategies. Here we can observe different kinds of effects. One is known as Werther effect. Media reports of celebrity suicide sometimes lead to imitative suicides, as seen after the death of an actor, Sushant Singh Rajput, in 2020. The excessive coverage of TV and social media reportedly correlated with increased suicide searches online. So this is known as Werther effect. There is another effect, Papageno effect. Conversely, stories of individuals overcoming suicidal crisis can inspire resilience. For instance, Indian newspapers have started highlighting farmers who sought help and rebuilt their lives. So thus preventing farmer suicides. Like it's an ideal, the role model where people are taking positive feedback and positive responses. So how we project, how we communicate matters a lot. Even the Press Council of India and World Health Organization recommend avoid sensational headlines like students kill self over exam stress or anything that can be sensational. Refrain from publishing photos or detailed methods. Do not get into detail of how he committed suicide or how she has committed suicide, what he or she has used, and entire detailed procedure and all is not required because that can trigger the suicidal thoughts, and already people who are vulnerable can get ideas from that and can also commit or prioritize such acts. So media should refrain from detailed methods or publishing photos or any such articles or footage, and provide helpline numbers at the end of articles. Always end with providing helpline numbers, because at the end of the day, we should give them a hope of life. We should provide them solutions, not end with problems, right? And highlight coping strategies and community resources. Like the Hindu newspaper routinely adds helpline numbers at the end of suicide-related news. It's a common practice, you can see, which is an observation. So anything should end with a positive note and with a hope for a better future. Now, even as informed social media platforms such as Twitter, now known as X, or Facebook, Instagram, and YouTube have become spaces where distress signals are expressed linguistically through hashtags like feeling depressed, need help, or visual posts. So platforms now provide automated prompt searching. Like searching suicide on Instagram in India shows helpline information. Even in Facebook, if you try to search suicide, it will show helpline information, support page. So online influencers and mental health advocates like psychologists, social workers, therapists on YouTube, Instagram are creating suicide prevention awareness in regional languages, including English, Hindi, Telugu, Tamil, Kannada, and so on. And even chatbots are used with AI, like Kiran Helpline, which can be accessed from 1800 599 0019, operates with multilingual IVR systems. And NGOs like ASRA are piloting WhatsApp-based counseling sessions. AI chatbots can provide immediate empathetic responses, bringing the gap until the human support is available. And AI algorithms analyze linguistic markers like keywords like sentiment emojis that are used in text or speech. Example, detecting frequent use of end, worthless, burden can detect suicide risk. In Indian context, code switching is being trained into models to improve accuracy. Generally, in Indian context, we use multiple languages at the same time, like we use code switching. We mix up Telugu, Hindi, English, or any other language. We use some words of Hindi, some words of English, some words of other language. So this code switching happens, and also code mixing happens. So even these models are trained on this to improve accuracy. So sometimes people can use non-native language. And mobile apps are growing, including telemedicine, telepsychiatry, mental health apps like Inner Hour, and so on. These apps use guided journaling and CBT-based self-help and daily mood tracking in multiple languages, crisis buttons connecting users to emergency helplines, like telepsychiatry services, like NIMHANS Tele-Mental Health Network allows remote consultations, especially for rural populations. In spite of all these, there are also challenges and ethical dilemmas like privacy. Data collected by apps and helplines must be secure. AI may misinterpret slang or sarcasm. So cultural nuances are there that needs to be addressed. And many rural populations lack internet facility or stable connectivity. So this can be challenging. Despite these challenges, technology has emerged as an indispensable tool in suicide prevention across the globe. So community engagement with cultural community-based interventions and cultural approaches like village level programs, school level programs, college level programs like peer counseling clubs, mentorship and counseling programs to address stress, anxiety in students, scholars, and faculty members can be initiated, and even for community members. And cultural and religious perspective can be part of this communication, like Indian society's spiritual traditions provide linguistic and cultural resources for resilience, like Hinduism emphasizes karma and the sanctity of life, and it prohibits killing of oneself or others. Buddhism promotes mindfulness and compassion. Sikhism highlights Chardi Kala, that is eternal optimism. Sufi traditions use poetry, music for emotional healing, and many more. Just I use a phrase. So religions leaders are increasingly being trained in suicide awareness so that they can guide communities compassionately. And educational campaigns use linguistically inclusive slogans, folk theatre and street plays like Nukkad Nataks, Burrakada, Dandora, or street plays. In Telangana villages, dramas in Telugu demonstrate how to talk about stress and encourage seeking help. And in similar other states, and family members and peer support often act as first responders and first step. So training them to recognize warning signs, withdrawal, changes in language, giving away possessions is vital. So case studies show that reduce suicides when families attend awareness workshops. And government policies and legal frameworks significantly shape the effectiveness of suicide prevention, which has made progress by decriminalizing suicide attempts and introducing national mental health programs. Yet, challenges remain in implementation, funding, and coordination. The Mental Health Care Act in 2017 decriminalized suicide attempts, recognizing them as a signs of distress, requiring care rather than punishment. A right to access mental health care services, establishment of mental health review boards, government's duty to provide affordable services are the key provisions. But challenges do persist, like limited awareness among police and healthcare providers, insufficient infrastructure and human resources. And we also have a national suicide prevention strategy, which was launched in 2022 with aim of reducing suicide mortality by 10% by 2030, integrate suicide prevention into primary health care, train gatekeepers like teachers, ASHA workers, police, social workers, and so on, strengthen surveillance and research, and so on. Institutional support systems like NIMHANS, Bengaluru, National Institute leading suicide research, and state helplines provide region-specific counseling, and NGOs fill service gaps through volunteer-driven initiatives and bridge the gaps between government and private. And international collaborations like World Health Organization, UNICEF, UNESCO collaborate with India in training, awareness campaigns, and data sharing. For example, UNESCO supports mental health promotion in Indian schools through its life skills education. And IASB, which is an international organization, with collaboration encourages, promotes organizing events like us. We are organizing today event with an integrated approach, multi-sectorial approach, integration of healthcare, education, law, media, language, linguistics, technology sectors, ensure sustainability and scalability. So finally, for everyone, for every sector, at every level, we can provide our recommendations, like for policymakers, strengthening implementation of MHCA Act 2017 and the National Suicide Prevention Strategy, allocate dedicated budget for suicide prevention in every state, district. For healthcare and social work professionals, we can train frontline workers in suicide risk assessment, include psychologists, social workers, counselors, and health and allied health medical professionals. For media and technology-driven organizations, making mandate responsible reporting guidelines so that they are provided with guidelines on how to report, what to report. Invest in AI-driven monitoring systems with multilingual capabilities to improve the overall efficiency of the awareness programs. In educational institutions, embed mental health education in curriculum, provide trained counselors in all schools, colleges, universities, full-time. For communities and families, organize community level, family level, village level, mandal level, ward level awareness programs, normalize conversations about suicides or mental health. Do not discriminate. So with sustained efforts, we all can move forward and toward reducing suicide rates and fostering a society where every individual feels heard, valued, and supported. Every life is worth saving, and every word we use can become a bridge between despair and hope. So let's reach out to the unreached and save lives. Like we have, before ending, we have suicide-related expressions in different languages to identify. Like common expressions in Hindi, we have Jeevan se haar jana. And in Telugu, general common expressions are Atmahatya. In Tamil, Uir Kollutal. Even in Bengali also it's similar, Atmahatya. In Urdu, it is Kudkushi. Kannada, Atmanash. In Marathi, Atmahatya. So similar expressions by when we identify, when we look at similar expressions, and they are used in different contexts like counseling or clinical or public campaigns, news media, poetry and media, or legal or medical contexts. We need to identify accordingly. So with this, as I have already provided you with helplines, hope you all have noted it. If not, we can again look at the helplines. Otherwise, I think we can close the session here and open for discussions. So any observations, any queries, let us know. Okay. If there are none, then thank you everyone for joining us on the 2-day international seminar on suicide prevention, health, well-being, and sustainable development. So in these 2 days, we have learned on various aspects of suicide prevention, from history to psychopathology, pathology, theories, and symptoms, therapies, interventions, and also various aspects like policy level, community level, individual level, organizational level, with different stakeholders like public, private, and individual. We have looked at various aspects. Hope this has been fruitful. And we congratulate everyone for being part, at least with whatever learning you had in these 2 days. You will be the warriors, crusaders of suicide prevention, and you will be able to save lives. So that is the greatest thing we can do. And we expect if one of you can save at least one life, then that is the greatest achievement we have made through these 2 days sessions. So I thank each and everyone for your valuable time sparing with us and learning insights. So we request everyone, we have launched feedback form. We request everyone to fill the feedback form, which has been shared in the form of polls before you leave the platform. So within a week's time, whoever has filled the registration form and feedback form in Zoom, they will be issued certificates. So thank you everyone once again. We have upcoming programs which are scheduled on a daily basis as informed every day. We have sessions going on. As per your convenience, you can join daily with the same joining link. And on 15th, as part of financial literacy series, we have a webinar on cyber security. As we are seeing, there are a lot of people losing out money, losing out their data, and compromising on their data, so on. To avoid this, we are having a webinar on 15th September at 6 o'clock. So we request everyone to not only attend, but also invite others and share this information so that they will also gain insights into this. You can share YouTube link to them, but if they join live, they will get more benefit as they will have opportunity to share in live sessions. So thank you once again. If in case you have any queries, you can write to wswd2025@gmail.com. Thing that has been already mentioned in the registration form, Google registration form, which everyone has filled. A copy of that form has been sent to your Gmail or whichever email address you have used. You can check your email. In that form, all the details are there. If you want to connect to us, you can use the email address. You can go back to your email. There you will get a copy. You might have already got a copy of your registration form. In that, all the details are there. And we'll provide a link. Now you are providing your email address. So to the same email address, we'll be sending you a Google Drive link from where you can download your e-certificates. So 2 days, you will get 2 certificates for each day. So whichever day you are attending, at least even if you are attending for 1 day, you will be eligible for certificate on that day. So you will get whichever day you have attended, you will be getting certificates. If you have attended 2 days, you will be getting 2 days certificate. In a week's time, we'll be sharing you through your email. In the same email, we will also be sending you the upcoming programs. Daily series is there anyway. We also occasionally organize the thematic programs. For that also, we'll send registration links. For daily series, you need not register. You can directly join and fill the registration form and feedback form. That is enough. For special programs like this, webinars or anything, you need to register for that. So for that, we'll be sending you links so that we can make necessary arrangements. Even if You might be experts in your own domains, or at least you are having knowledge in your own domains, experience. You can share. You can contact us to be a resource person, and you can make presentations so that you can share your knowledge to everything. So thank you once again. The feedback form will be there for another 5 minutes for everyone to complete. See you all tomorrow at the same time with the same joining link for different commemorations and celebrations. Take care. Good night.